ap toujou mieux la vie dehors. Monogamie, c'est tout.
Hi, welcome everyone to our next episode of Saturday Tea Night. Hello, ladies. How are you feeling tonight?
Hello, welcome back everyone. I am feeling great. What about you, Katia?
I'm feeling amazing today. Today is a very emotional day, I'll say, but so far so good.
Yeah, it's been a tough week, but the weekend is starting well so far, so I'm happy.
The weather is beautiful.
Oh yes,
It is.
right?
Yeah, it was
Well,
since yesterday actually. Yes.
yes, we've been having a great weather since for the past few days, and it's fall. Can you believe this? And we have that. It's very warm outside.
Yeah, it was very warm. It's still warm. I don't know what's going on, but it's the weather. And due to the victory that we had today, so we had to make our event 1 hour earlier to make sure we accommodate everyone for the next hour so they can see the presidential speech and everything.
Yes,
It's all about the audience, you know.
yes, and we are thankful that all of you guys can join us tonight to speak about this a very important topic.
Yes. So again, we want to welcome everyone to our next episode. And for those of us who don't know us, we are Mama Wellness Club, and our mission is to inspire healthier family by empowering mom with the education, resources, and support pre and post conception. Tonight we have a very interesting topic that most mom can relate to. And I know most of us, we are sometimes afraid or even scared to even address this topic. That's why we feel like it's very necessary to discuss this topic and for moms, family, husband, friends to learn about postpartum depression. Then I will leave you guys with love.
Yes, totally. This topic it's something that most mom can relate to, and sometimes we are scared of addressing it. Like me myself as a mom, I'm sure I went through some of the symptoms, but I didn't ask anybody, and the feeling that I had at the time, I'm like, okay, you know what? I'm gonna get through it. I need to get over this. But I didn't think that, this is something that I'll probably have to look for help or talk to somebody so that this cannot go any further, getting worse. So then me and my family can be in a better situation. So I totally agree. This topic it's relevant and it's very important. That's why tonight we are bringing a very, very special guest. She is a board certified family nurse practitioner. Her name is Katia Desrosiers. She is a good friend of ours. Welcome, Katia. How are you?
Hello, everyone, and everyone who's watching. I want to start off by saying thank you, ladies. I am honored to be here with you guys. As you said before, talking on such a sensitive topic. So, hopefully we cover all the bases. We're here to listen to everyone's stories, answer any questions that everyone may have. But thank you again. Appreciate it.
Thank you. So, to start, we have to give a definition. What is postpartum depression? Because a lot of people don't know what is postpartum depression.
Right. So before I actually jump into postpartum depression, I wanted to mention something called the baby blues.
Oh, yeah.
So the baby blues, you do experience some of the symptoms of postpartum depression, which I'll go over as well. But these symptoms aren't as severe. They usually appear a few days after you deliver, and they typically don't last more than 2 weeks. So that's how you know you have the baby blues. And over time, that 2-week period, your symptoms start to improve. Now, sometimes we get to a point where the symptoms don't improve, the symptoms become worse, or even you're unable to even take care of yourself or do daily things or even take care of your baby. Then we really get into the definition of postpartum depression.
Interesting. So you're basically saying that if someone don't get over the baby blue stage, it can lead to postpartum depression.
Correct. So if 2 weeks have gone by, your symptoms haven't improved. Now these symptoms are starting to affect, you aren't able to take care of your baby, you aren't able to take care of yourself. Then we really go into the diagnosis of postpartum depression, because at that point we're no longer in the baby blues stage, as they call it. Now we're kind of really more so into the postpartum depression stage. And as you said before, a lot of people don't even know. They're like, they're going through these changes and they're not even aware that this is an issue. And some questions that I feel like come up is, why can't I do this? What's going on? Why am I not bonding with my baby? And it's scary. I can only imagine these are things. And some people may feel ashamed, embarrassed, like, I'm a mother, I should be able to do this. So that's why I'm so happy we're on this topic. And it's to bring awareness, because we all know it takes a village. Let's say if I may be going through something and my husband doesn't understand, or my family doesn't understand it, it doesn't make me so open to go and say, let me tell them I have an issue. Let me, this is what I'm going through. I may recognize the signs and my family doesn't understand. Now I may be embarrassed to even recognize it as an issue. So I'm just happy to be here. Talk about that.
I love it. So going back to what you just said, Katia. So I just want to ask, so every mom can experience baby blue. Every mom, once they have a baby, it's normal to experience baby blue.
Yes, this is a normal thing. It's not only for first-time parents. I feel sometimes we think it's only for first-time parents who aren't sure, but you can have 3 kids and then develop postpartum depression or even baby blues on your 4th child. So it's different each time. Sometimes, like some of the symptoms, we can go back to baby blues. Some of the symptoms of baby blues in that first 2-week period could be mood swings, anxiety, feeling overwhelmed, very irritable, reduced concentration, appetite changes, trouble sleeping, sadness. So again, if these symptoms go past a 2-week period, and they start to worsen, because baby blues, you can have these symptoms and you're still able to function.
Yeah,
so I think it's really when we start to diagnose postpartum depression is after 2 weeks, and it's starting to interfere on how you're functioning with yourself and as a parent.
Okay. So what may cause postpartum depression? Because after we pass the baby blue stage, so what may cause it to last longer to lead into postpartum depression?
Okay, that is a great question. So I actually did my research. And the exact cause of postpartum depression is still unknown, but there are many different causes and risk factors that can play into postpartum depression. One of them is hormonal changes. Even during your pregnancy, everything is up, down, and around and out of whack. And these are things that can cause, an effect on your mood and how you're feeling. Body changes. I'll never forget when I was pregnant with my son, who's now 7 going on 8. I was like 135 pounds. I didn't gain any weight during the pregnancy. And once I delivered him, I gained 40 pounds.
Oh, wow.
And now I'm like, what do I do with this weight? Now my clothes don't fit. So now you're like, okay, so sometimes it's the appearance. It's really, social relationships. Now you don't have as much time to maybe hang out with your friends or, go to certain functions. And especially at a trying time like this during COVID, now you don't even have visitors. You can't have people even come visit. So this is definitely a trying time for, I feel for people who are having kids at this time during like COVID. But relationship, if you had a rough pregnancy, that's something that can contribute to that as well. If you had a rough delivery, the recovery period, let's say you had an emergency C-section. Now your recovery period is longer. So not only are you trying to, be a parent, but now you're also trying to recover yourself. And trust me, the list goes on. I'm sure everyone can really, lack of sleep, breastfeeding.
Oh, yeah.
Breastfeeding can definitely cause that. You're trying, and let's say the baby's not latching right away. Now you're concerned, is my baby getting enough, Also changes in work. Like I have, now you're thinking I have to go back to work. What about a babysitter? Who's going to watch the baby? And as a new mom, I know myself, I cried when I went back to work.
Yeah, you mentioned about breastfeeding when baby is not latching enough, and that happened to me recently with my two previous baby. I had no problem with them latching, but with my newborn right now, she wasn't latching. 2 weeks after we get home from the hospital, the day after, 2 weeks later, it's like she's a totally different baby. She wasn't latching, but it was the same breast she was getting for the past 2 weeks. I'm like, what's going on? What am I doing? And then because she's not latching enough, which the breast milk wasn't coming enough for me to feed her. So
right.
I started pumping that early, as soon as she wasn't latching, and then she was fine with the bottle. And I'm like, oh my gosh, maybe what's wrong with my breast? Why doesn't she want to take my breast? And now she prefer the bottle instead of my breast. And that was one of my concern as a third time mom. And that bothered me, even though that it's not my first time. And then it lasted a few months until 3.5 months. That's when I started to manage better with that symptom.
Yeah. It's really
Oh, there's a little difficulty.
Yes.
We're having a little technical difficulties.
Yeah, like from what you just said, love, it's really weird. Like, with your third baby, you think like you get it, like you breastfed already and all of this, and now with your third baby, it's really, I believe that you were actually confused. Maybe you were confused and anxious at the same time.
Yeah, probably. And also with the body changes, even though that I know what I was supposed to expect, right? I've gained weight before, I've lost weight before with my first and second and third baby. Now my third baby, I'm like, oh my gosh, look how much weight I've gained. Like, when am I gonna lose this? What am I gonna do? But then I'm like, you know what? I know I did it before, and I'm sure that I will be able to do it again. So hopefully this doesn't bother me too much.
Yeah. And from what you just say, also, I believe with when Keita was saying the curses and etc. I just realized that with my first baby, I went through postpartum depression, and I was so first of all, I was confused and I was afraid to being judged, and also I was afraid for someone to say, "Oh yeah, this is motherhood for you," and I never was able to discuss it with someone or even let someone know that I went through it until I believe I told my friend when I was pregnant with my second baby, and she was like, "Why you didn't tell me?" I said, I don't know. I was just afraid to even mention it to someone."
Yes, you're right. And I'm sure a lot of us, especially with our family, if you don't have the support, if you don't have someone supporting you, if you tell them what's going on, how you're feeling, but they're not supporting you, it's like you feel like maybe I'm supposed to be like this. Maybe that's how motherhood is. Maybe this is the new normal. I have to accept it. But then it's not right. You're suffering on the inside, and sometimes it's affecting the family, your husband. It's like sometimes you get mad at people for no reason. You're like, why? What's going on?
Stop.
Or you go
And you feel hopeless because now you're afraid of telling someone that you're going through baby blues or postpartum, and then at the same time you still need to take care of your baby because your baby is still a newborn.
Yes.
Then you can even tell someone. Now it's like you carry like a cargo on your shoulder, and how you hoping for like someone to help you while you're not even saying anything.
Totally.
Yes.
Yeah. So yeah.
So that's why we feel like it was very important to discuss this topic, and also to let moms know that it's okay to call a friend. It's okay to let your husband know what's going on, or let your family know. And also, the reason that I say it's also important for family, it's because, with that being said, you can help a friend. Like, let's just say your friend just had a baby, you can help your friend. Like, you should know, maybe if you see the sign, you can help them.
Yeah.
Tetia is back.
Tetia is back.
Sorry,
Yeah.
ladies. Out of all the times the laptop decided to shut down and update, it did it now.
Well, this is technology.
So I'm
It
back.
happened. Welcome back.
All right. Just catch me a little up to speed where we were. Sorry.
Yes, you were saying, describing the sign
Signs.
of postpartum depression, and Evelyn was sharing her experience, like with her third baby, that because she wasn't able to latch, she felt that she was going through either baby blue or postpartum. And also, I was sharing my experience with my first, that I was going through postpartum, but I was afraid to tell even Evelyn, my dear friend. But I was able to actually go to her house, like make sure I'm near her without even saying anything. My husband would drop me and the baby, to her house so we can spend the day.
Aw. And I'm happy you mentioned that, sometimes you don't want to say that you're going through this. I find a lot of times, as I was saying before, you don't want to feel like, I can't do this.
Mm-hmm.
You don't want to feel like, why can't I do this? Like, exactly what's going on. That's why I do feel like, me personally, I do feel this needs to start from your first OB visit. Some people aren't even aware there is such thing as baby blues or postpartum depression. I do believe this is a conversation, and I guess that puts the responsibility on us as providers to really provide people with the information. Like, hey, your hormones will change. That happens, and that can cause you to feel this way and that way. I don't know if everyone knows, but I do have experience working as a nurse in postpartum. And what I find is that we give people all of these papers on delivery day. So you just had your baby, you're excited, the family's pumped up, everything's going well, and then they give you a stack of papers. Do I really have time to read these papers? I don't.
No.
And you'd be surprised, a lot of the resources are in these books, but then if we don't point it out, or if maybe I wasn't aware during my pregnancy there are these resources, chances are I'm not reading these papers. And I don't want people to feel guilty about that. It's hard. You're still adjusting, your body's adjusting, and you're just trying to be the best parent that you can be. And unfortunately, you may not have time to go over these booklets and pamphlets and papers, and then you miss the information.
Yeah.
Or by the time you check it, the baby's already 1 year old.
Right.
And you're right. When you go for your checkup after you give birth, you only have one postpartum visit. It's like, after seeing you for a monthly appointment, by monthly appointment, come down to weekly appointment before your due date, and after you deliver the baby, you only have one postpartum visit before they give you clearance for you to get back to your normal life.
Right.
And sadly, this is something, like you mentioned, as provider, you guys they should definitely make it more aware, to take it in consideration that, mom needs more than that.
Right.
Yeah, actually, speaking for myself, and that's why I just want to mention it to all the moms, future mom or new mom. Make sure you have a good pediatrician. And I'm grateful for that, because my pediatrician, every time I go visit with my baby, she always asks me how I'm doing. She always asks me how I'm feeling, what I'm doing, and and I really appreciate it, and it was really helpful. But I was still afraid to mention that I was going through it, because I thought that mentioning it, they might give me some medication, they might try to. I didn't know the consequences. That's why I was so afraid to even address it.
And there are hotlines. There are hotlines. I don't know if afterwards, maybe under the YouTube video, we can post some links. I do have like a few links, and they're free. You know, you don't have to pay for these resources. So, and everything works differently for everyone. Is different in the type of help that they need. One person might think it's best to just speak to a family member or maybe someone who can relate. Others may be embarrassed to speak to their family member and more comfortable with calling the hotlines. There are support groups, and I hope, you know, people who are watching or anyone who has gone through this, you know, start your own support group. Why not? You know, put it out there. We have the platform. We have Facebook, we have Instagram, you know, YouTube. You can start your own wellness club. Let's share our stories, because I feel like a lot of people think they're the only person in the world going through this.
Mm-hmm.
And according to the Centers for Disease Control, 1 in 8 women experience postpartum depression. It's common, you know, and maybe if you start a support group, I feel like people who have gone through this, or we should really kind of put it out there so it's not something shameful, or you don't want people to feel embarrassed to really talk about this. And the hotlines are free. They're 100% confidential. You know, like you said, even myself, as a nurse, when I delivered my son, there's certain things you were afraid to say. Are they going to put that in a chart? Are they going to think, you know, what are they going to say about me in this chart? You know, because you don't want to be embarrassed, but then it's out here. And I think postpartum depression has been a thing for a really long time, but it's really being recognized. They're saying, hey, these are the signs, these are the symptoms to look out for. And I'm happy you mentioned the postpartum visit. Truth be told, also, you're not in there for long.
I know.
They're only clearing you. They clear you and say, okay, it's the next person.
Yeah.
Then before you can even tell the doctor, hey, by the way, you're already in the waiting room.
I know.
Yeah. Yes, that's true. I remember my husband, I made him wait for me in the car, and by the time I came back, he's like, that's it? I said, yeah, that's it.
You know, you mentioned your husband. That's one thing I want. You know, do dad also go to postpartum depression? Is it only moms that go through it, or is it something both can go to?
No, actually, both dads can go through postpartum depression as well. They definitely can. They can experience the same symptoms, the mood swings, the irritability. Now, and sometimes if mom is going through postpartum depression, that can trigger dad to go through the same, especially if he doesn't really understand. And let's say, for example, you know, unfortunately, let's say if you have a colicky baby, a baby who won't sleep. Now you're on lack of sleep. You're stressed out. Dad is going to work. They can definitely have postpartum as well. It's actually called paternal postpartum depression. And the help is out there. The hotlines are not just for moms or dads. They're for family members. I can have a sister who's going through postpartum depression and I don't even know what to do, or I may not understand it. They do actually encourage family members, hey, call this hotline. Tell us about your family member so we can try to help you understand and also help them find the resources and the help that they need.
So if they is it only medication that help? If, like, let's say I have postpartum depression, but I'm worried that I'm breastfeeding, I don't want to take no pills. Like Jenny mentioned, she didn't want to take any pills, so she don't want to address that. Is there other form of way that the medical field help you to manage that, or just you go straight? They have to give you a prescription for pills or something?
No, not necessarily. To touch on the medications now, there are antidepressants that can be prescribed, but it's very patient specific. That's why I do encourage people, once you're in that baby blue stage, and of course, to explain baby blues again, first 2 weeks after delivery, you're having these symptoms, they're mild, they're getting better. After that 2-week period, if you start to get into that postpartum depression state, you definitely need to reach out to your doctor. Definitely reach out to your OBGYN, because now you can have a conversation with your doctor. The treatment should really be not the doctor's decision. It really should be a collaborative decision to say, what will work for me? What do you think will work best? Some people need medication, others don't, and they're not 100% sure, but there are support groups. As I was saying before, I even kind of did a little search on Facebook. you'd be surprised how many Facebook pages that are actually on postpartum depression. And these are moms who are just sharing their stories. Sometimes that's all you need. Hey, it's not just me, like you get that reassurance. You can do the online hotlines, and the hotlines, some of them set you up with actually a provider over the phone to have a conversation, because then we get concerned about, if you start to have feelings like you feel like you need to harm yourself or your baby, that becomes a concern after a while, and they will have the conversation with you. They will ask you these questions, and it's 100% confidential. There's also counseling. Sometimes all you need is just maybe to speak to a therapist. And counseling doesn't necessarily mean, in my opinion, that I have to go to an outside office. If I call Evilly to say, Evilly, I remember you went through a situation and we talk about it, that's something called talk therapy, psychotherapy. Now, Evilly's sharing her story and I'm sharing mine, and Evilly may have an insight now on how to kind of get through this. So we don't necessarily have to jump to the medication route. And if you are breastfeeding, they do say, which is why you do have to have the conversation with your doctor, the benefit has to outweigh the risk. Now, there is a small portion of the medications that does pass through your breast milk, but then it all depends on where you are in that stage. And of course, unfortunately, sometimes other options other than breastfeeding would have to be reviewed if you start those medications.
That was very informative, and we have a lot of viewers that's asking questions under the.
Let's see. Okay, let's get to some. Hey, let's see. Okay. I'm sorry, I'm taking over.
No,
Go ahead.
go right ahead. I think the first one is, how can you prevent postpartum depression?
Yes, from Regine Sagbird. Did I say it right?
Oh, yes. How can you prevent postpartum depression? It's a very, very tricky question in a sense. Sometimes it's inevitable. It's not easy to just say, I'm not going to have postpartum depression. If you have an underlying history of depression, that does put you at a higher risk for postpartum depression. But we do say certain things that you can do is, when you have a really good support system, that can help. Now, let's say it's not just me and the baby. I'm up all night and, my husband's at work or my family isn't around. But if you have a really good support system, try to talk about your issues. Try to be as informative as possible as well during your pregnancy, so things aren't a surprise to you. I know certain offices do provide like mommy and me classes. So it's not when I deliver the baby, now I'm trying to learn how to change a diaper, feed the baby, breastfeed, and all of these things can become overwhelming. So I think being informative helps. Still doesn't necessarily say that you won't go through postpartum depression, but maybe even networking with other parents. My sister and I were pregnant around the same time. We delivered our babies a few days apart. And she was amazing. My sister read everything. She read all the books, and all I had to do was kick my feet up and wait for her to call me and tell me what she read.
That's amazing.
That helped me. But try to just know that you're not in this alone. Take the help from friends and family, all the support, the support system. Like I said, it does take a village. So they find that people who do have a really good support system, who are more open and informative in regards to changes in your body, what to expect when the baby comes, and it's simple things, learning how to put the crib together before, so you're not rushing to put the crib together, or learning how to use your stroller, or even the car seat, which I struggle with. But these things can help. Therefore, you're not as stressed. You're taking some of that potential stress load off of your shoulders when the time comes for you to deliver your baby.
That is great. Very informative. Thank you. Yeah, we have another question from Patricia. And what is the worst case of postpartum depression have you seen working? Since you work as a nurse practitioner, what is the worst case practitioner? What is the worst case of postpartum depression you've seen work in these cases?
Okay, so I actually worked in postpartum and recovery, labor and delivery as a registered nurse from 2014 to 2018. As a nurse practitioner, I don't currently work in the OBGYN department, but I will say we've had cases in the hospital when I did work as an RN, even on the postpartum unit. And let me remind you, they don't stay there more than 3 days. We've had cases on a postpartum unit where we had to call social work. We had to evaluate with psych. And the changes in your body happen so quickly that some people, unfortunately, aren't able to handle it. And you have no control over, especially your hormones. You really have no control over that. Your body is changing. There are people who develop diabetes during their pregnancy and hypertension. These are things that you can't control, but unfortunately, they play a factor in how your recovery period and how your postpartum period will go. So unfortunately, I don't have too much experience as a nurse practitioner working with the OBGYN population, but in the hospital, we've definitely had cases where we had to kind of, pull back, take the baby to the nursery and kind of give mom that time that she needed. And then we had to go higher up with like even a social worker and a psychiatrist.
This can be very serious.
And from what you just mentioned, and I was doing some research online, and what you just say, Ketia, and I just want everyone know that it has nothing to do with weakness. If someone takes longer to recover from postpartum depression, I just wanted to mention it. It has nothing to be like with a strong mom, or maybe how you're going through it. You look so strong. It has nothing to do with being strong or being weak.
Let's see. So Vicky mentioned the pamphlets are not always easy to understand neither. And we actually spoke on that. Like sometimes you don't even have time to read them. And yes, I will say sometimes they're not that easy to read either, which is why I think I actually last night went on the CDC website and they really spell things out for you without all the extra medical terms that people may not understand, which is great. Because if I'm not in the medical field, I may not understand certain terminology, and now the information is useless. I do think when I worked on postpartum, we actually used to go over those pamphlets and say, how can we make this easier? Maybe put certain things in bold, put it in red, what we want to stand out.
We say it to the patient instead.
Right. That's another way. But then it's like, again, and it's like we wanted to do so much, but they only spend 2-3 days in the hospital. And we always try to encourage, the practice, the OBGYN practice. As soon as you get that test that says you are pregnant, let's start little by little informing parents on what to expect. I can't imagine delivering a baby and now I'm thrown all of this information. When am I supposed to process it? I don't think they have enough time.
And honestly, when they give them to me, I don't read it. I just put it away somewhere.
I just put it in my diaper bag, my diapers bag. Right. We have Jean Glamour, and he asked, "How can I help my spouse with postpartum?"
Oh, that is a very good question. So, definitely being sensitive to the situation. There are cases in that we have seen, unfortunately, where the spouse doesn't understand, so he's just not really empathetic to the situation. It's more so like, hey, you're a mom, you need to do this, or why aren't you doing this, and not really understanding. I think it starts with understanding, which is why, hey, go to those GYN appointments, go to the OB appointments, go on the hotlines. You can even call the hotline. So the hotlines are not just for moms who are going through situations, they're also for family members. You can call and they can kind of assist you in that direction. And as well as I was mentioning before, with moms being informed little by little, so you don't overwhelm yourself. You take a little bit of information at a time. Dad, come on in, bring your sister, your brother, and whoever else so they can understand. And I think that's where a lot of the embarrassment comes from, when your family doesn't understand, like, what's wrong with you? Why don't you know this? And now you feel that pressure, like, okay, so now I can't speak to them. We have to start with understanding that this is a real thing. It's not make believe, and it's not something to be shameful of. We really have to be more sensitive to the topic of postpartum depression. So now your spouse does feel comfortable to come talk to you about it. And then again, together, you can work on trying to make the situation a better situation.
Daphne from YouTube. We have one commenter for YouTube. She asks, how long does it typically last?
So postpartum depression can last, believe it or not, up to a year. It can last up to a year, unfortunately. And doing my research, looking into postpartum depression itself in general, a lot of the times is from parents who have not actually sought help. And it could be that they're embarrassed, or it can also be that they don't even know they're going through postpartum depression. They're not even aware of the signs. They might think, maybe this is normal. Maybe this is what's supposed to happen. Or I don't want to say anything because now I'm ashamed and embarrassed. And they don't seek the help that they actually need, or even talk to anyone about it. As I mentioned before, help doesn't necessarily have to mean I have to pick up the phone to speak to a complete stranger, because that may not work for me personally. But if I have a friend who I know, you know what, she had a baby, let me call her. It's always nice, and we share our stories. That alone is the support group. It may not be a group of 4, 5, 6 people, but I have my friend and I who's having a conversation. And again, that's talk therapy. We don't really need a license for that. All we need is the experience.
I know, right? And this is exactly this is what me and Jenny are doing right now. Especially both of us, our newborns are a month apart. So we basically call each other, and then this is what's happening. Did you go to that? Did that happen to you? It's like talking to each other make us feel like we feel better. Something that's so simple that could stress us out to the extent, but because we are speaking it out, sharing our experience, make it more laid back and easy to understand. I'm not the only one. She went through that too.
Yes. And, also, there's something I just want to ask. I know it's getting late. What do you think someone should avoid saying to a mom going to postpartum depression? You think that's something that might trigger the moms?
I think that kind of, why aren't you able to do this? Don't question the ability of someone being a parent. That's hurtful. That's very hurtful. My son is 7. And if someone says to me, well, why don't you do, I'm already on guard now. Because now I know, you know what? I don't even want to come to this person. And now you are pretty much questioning me as a mother. And it's insulting. It's embarrassing. I would definitely refrain from even ridicule. Like, if I come to you and confide in you to say, hey, this is what's going on with me, don't wait till I'm in a group to say, oh yeah, Ketsy's going through postpartum.
Oh my God.
Like, it's not like, we laugh about it and, to kind of lighten up the situation, but it's a real thing. It's a diagnosis. It's something that is diagnosed. It's real. So let's not downplay it. Let's not downplay like, oh, you'll be fine. Oh, don't worry about it. Kind of like that. Because sometimes all it takes is for someone to understand, or even to just have a conversation. And as I said before, unfortunately, sometimes it gets further than that, where medications are prescribed. But then again, it is a case-by-case scenario.
Thank you so much. Thank you for this topic. Thank you for make everything clarify to everybody. Thank you for giving us the resources. Thank you for giving us all this information. And I feel like I'm in a better place now understanding postpartum depression.
No, thank you for having me. I'm so excited. I was so excited and nervous, but
we did
it. You made it.
It's definitely a sensitive topic, and I really do hope anyone who's watching, like I said, you don't have to be a parent to really understand. You can help you can help anyone, and I'm sure it will be appreciated because everyone is different. But we're here. We're all in this together. and we're just here to help each other. So thank you for having me. I do appreciate it.
Thank you so much. Yeah. Also, I just want to let the ladies, our audience, know that we will have more resources available, and also for my researches, they mentioned that it's very important for new mom. I mean, not new mom, like once you have a newborn, to do a mental health checklist, and we have that brochure. We will have it in our group page starting tomorrow. So I encourage our audience, if you're not part of the group, to make sure you join us so we can learn more, and maybe do the mental health checklist. I feel like it will be very helpful for to understand what you're going through and what kind of help you think you might need. So
yes, and that's why we have the private group for. So we moms, like Ketia, like we mentioned, sharing our experience, sharing what we as mom going through can help. You never know. Sometimes I might ask a question on the group, and then Jenny is going through that, or you, Ketia, went through that, and then each of us can help by enlightening the question, make us feel better. So that's why, ladies, join the group so that we can keep sharing our motherhood journey, so that we can empower each other, so we can be better. That's how we are learning.
And you'll get through it. You will definitely get through it. You know, everyone, you'd be surprised. You'd be surprised. I kind of just did a little search on my own, and there are so many groups on Facebook. And like I said, we have the platform. You know, let's not make this a shameful thing. Let's put it out there. Like, you know, dads can go through postpartum. We even forget about the fathers sometimes, you know? So it's like we can, you know, you can start your own support group. I do see in the chat that some people have asked what are the signs. So we're posting the video, correct? Because I did go over the signs as well. So if you didn't catch us in the beginning, there's more information in the beginning of this video. So hopefully we covered everything, and I really hope you guys can take something away from this.
Yes.
Thank you
again. Thank you everyone for joining us tonight. I know it's getting closer to 8 p.m. and you guys need to watch our speech, the famous speech at 8 o'clock. So we're not trying to keep you for too long. So we want to say thank you again, and see you guys in 2 weeks for our next episode. You want to say something else?
Yes. Oh, yeah. Remember to like the Facebook page and follow us on Instagram. We'll have more topic coming up for you guys. We are excited, and thank you, audience. Thank you so much for joining us. We'll see you in 2 weeks. Thank you, Ketia.
All right. Thank you, ladies. Have a good night.
Good night. Bye.